I didn't start this because I believed in a miracle. I started because a friend of mine, a man I respect, a retired biologist who still reads journals for fun, asked me a question I couldn't answer. He was sitting at my kitchen table, and he pushed a plate of roasted root vegetables toward me. "Why?" he asked. "Does everyone assume that if it grows in the ground, it's good for you?" I laughed at first. It seemed like the kind of contrarian question a retired academic asks just to stir the pot. But he wasn't being difficult, he was being precise. He told me that for years he had been struggling with his blood pressure. He did everything right. He walked every morning. He cut out the processed food. He took his medication. And still, his numbers would spike unpredictably. He started tracking everything, every meal, every stressor, every sip of water. And he noticed a pattern that his doctor hadn't mentioned and that no wellness article seemed to address. It had nothing to do with salt. It had everything to do with the vegetables on his plate. Now, if you are over 40 or over 50, or especially if you are over 60, you have likely been told your entire life that vegetables are the unqualified heroes of the diet. And they are, for the most part. But here is the nuance that modern health messaging often forgets. Context is everything. What is medicine for one body can be a stressor for another. What feeds a 30-year-old heart might strain a 60-year-old vascular system. We are taught to look at food in terms of good and bad, but the body doesn't work that way. The body works in signals, cascades, and thresholds. This is not a video about avoiding vegetables. Let me be very clear about that. This is a video about understanding the hidden physiological conversation happening between your plate and your blood vessels. It is about a specific mechanism, a biological handshake, that most people don't know exists. And for those of us navigating the changes that come after 60, understanding this handshake can be the difference between managing your blood pressure and constantly fighting it. We are going to talk about a concept called the cephalic phase response. It sounds complex, but it is simply the way your body prepares for digestion before food even hits your stomach. It is the smell, the sight, and the chemical signature of what you are about to eat. And certain vegetables, particularly those in specific families, carry chemical signatures that can inadvertently signal your body to constrict blood vessels, retain sodium, or spike your heart rate. Not because they are bad, but because they are powerful. And when you are over 60, your body's ability to regulate these signals changes. The buffer zones shrink. So let's walk through this gently. Let's look at the science of how certain vegetables interact with an aging vascular system. And let's do it without fear, but with respect for the complexity of the body you are living in. The mechanism. How your plate talks to your arteries. To understand why some vegetables might be problematic for high blood pressure in the over 60 demographic, we have to look at the chain of command inside your body. It's not just about the nutrients, it's about the biological signals those nutrients trigger. Think of your body as a highly sophisticated communication network. When you eat, you aren't just depositing fuel, you are sending messages. These messages travel via your nervous system, your hormones, and your bloodstream. They tell your organs what to do. For most of your life, your body has a robust error correction system. If a food sends a signal that slightly raises your heart rate, your parasympathetic nervous system, the rest and digest branch, kicks in and balances it out. It's like a thermostat that adjusts automatically. But as we age, particularly past 60, that thermostat can become less responsive. The blood vessels lose some of their elasticity. This is a process called arterial stiffness. The kidneys, which are the master regulators of your blood pressure, may not filter sodium as efficiently. The baroreceptors, specialized sensors that detect changes in blood pressure, become less sensitive. This doesn't mean you are broken. It means your system is operating with less buffer. It means that signals that once caused a minor, easily corrected fluctuation now cause a more significant, longer-lasting shift. Now let's introduce the vegetables. Many of the vegetables we are taught to revere belong to the Brassicaceae family. Kale, spinach, broccoli, cabbage, arugula, collard greens. They are packed with vitamins, fiber, and antioxidants. They are, in many ways, foundational to good health. But they are also rich in compounds that are biologically active. They contain nitrates, which are often praised for lowering blood pressure, and that is true for many people. But the story doesn't end there. The issue for some individuals, particularly those already on medication or with compromised kidney function, lies in two specific areas: potassium load and vitamin K concentration. These are not toxins, they are essential nutrients. However, in the context of an aging body with high blood pressure, they can create a cascade of effects that work against you. First, potassium. Potassium is vital for heart function and muscle contraction. It works in a delicate balance with sodium. If you have healthy kidneys, excess potassium is excreted without issue. But as kidney function naturally declines with age, a process that is accelerated by years of high blood pressure, the ability to regulate potassium diminishes. Suddenly, a diet heavy in high-potassium vegetables like spinach, Swiss chard, and beet greens can push your serum potassium into a range that affects the electrical conduction of your heart. This doesn't happen overnight, but it is a chronic stressor. Second, vitamin K. Vitamin K is critical for blood clotting. It helps your body form clots when you are bleeding. If you are on blood thinners, a common prescription for those with high blood pressure to prevent stroke, a sudden increase in vitamin K from vegetables like kale, collards, and parsley can interfere with your medication. It can make the medication less effective, creating a dangerous fluctuation in your blood's ability to clot. The mechanism here is not the vegetable attacking you. It is a miscommunication. It is your body, with its altered thresholds, receiving a signal that is now too strong for the system to handle quietly. So, when we talk about avoiding certain vegetables, we are really talking about recalibrating the signal strength. We are talking about learning which foods send a message that your current physiology interprets as stress rather than nourishment. The benefits count down. Let's walk through the specific benefits of adjusting your vegetable intake. We are going to count them down from number 10 to number 1, and with each benefit, we will anchor it back to the science so you understand exactly why these changes matter. 10. Stabilized heart rate variability. Heart rate variability, or HRV, is a measure of the time gap between your heartbeats. It might sound counterintuitive, but a healthy heart doesn't beat like a metronome. It has subtle variations in timing, controlled by the push and pull of your sympathetic, fight or flight, and parasympathetic, rest and digest, nervous systems. Higher HRV generally indicates a resilient, adaptable nervous system. Lower HRV indicates stress and rigidity. When you consume vegetables that are very high in potassium or that contain compounds which mildly irritate the gut lining, like the oxalates found in spinach and Swiss chard, you can inadvertently trigger a mild sympathetic response. The gut has its own nervous system, the enteric nervous system, which is in constant communication with the brain via the vagus nerve. If the gut detects something it perceives as an irritant, it sends an alarm signal. This signal can slightly elevate your heart rate and lower your HRV. By selectively choosing vegetables that are lower in oxalates and more easily digested, you allow the gut to remain calm. You reduce the background noise of low-grade irritation. This allows the vagus nerve to do its job more effectively, promoting a state of rest and digestion. Over time, this translates to a heart that is not constantly being nudged by gut-derived stress signals. You are not adding a stimulant. You are removing a chronic low-level stressor. This is about creating the conditions for nervous system coherence. 9. Reduced microinflammation in the endothelium. The endothelium is the inner lining of your blood vessels. It is a single layer of cells, but it is incredibly active. It regulates blood pressure, controls clotting, and orchestrates immune responses. Think of it as the delicate silk lining of a high-performance hose. If that lining gets rough or inflamed, everything downstream is affected. Certain vegetables, particularly nightshades like tomatoes, peppers, and eggplants, contain alkaloids. For most people, these are harmless. But for a subset of the population, particularly those with autoimmune tendencies or existing inflammation, these alkaloids can act as mild irritants to the endothelial lining. This irritation triggers a low-grade inflammatory cascade. The body sends immune cells to the site, which can stiffen the vessel wall and make it less responsive to signals to relax. By identifying if you are sensitive to these compounds and adjusting your intake, you reduce the inflammatory load on the endothelium. You allow the lining to remain smooth and slick. This is not about declaring nightshades bad. It is about recognizing that for some aging vascular systems, they are a source of unnecessary friction. Removing that friction allows blood to flow with less resistance, which is a fundamental goal in managing blood pressure. 8. More predictable medication efficacy. This is a practical, non-negotiable point for anyone on prescription medication. As mentioned earlier, the vitamin K in dark, leafy greens like kale, collards, and spinach directly interacts with blood thinners like warfarin. Vitamin K is a key component in the clotting cascade. Your medication works by inhibiting that cascade. If you suddenly flood your system with vitamin K, you are essentially counteracting the medication. The danger here is not in eating greens, it is in inconsistent eating. If you eat a kale salad one day and none the next, your blood levels of vitamin K fluctuate wildly, and your medication cannot keep up. This creates peaks and valleys in your blood's clotting ability, which is far more dangerous than consistently being at one level. By choosing vegetables with a more moderate and consistent vitamin K profile, such as green beans, zucchini, or carrots, you create stability. You allow your medication to work as intended, without the surprise interference of a massive nutrient load. This is about respecting the pharmacology of your own body and creating a predictable internal environment. 7. Improved electrolyte balance. Without renal strain. Your kidneys are the gatekeepers of your internal environment. They filter your blood, balancing sodium, potassium, and other electrolytes. High blood pressure is often a disease of the kidneys. Either they are holding on to too much sodium, or they are struggling to filter efficiently. As we age, the number of functioning nephrons, the tiny filtering units in the kidneys, declines. This is a natural process, but it means each remaining nephron has to work harder. When you consume massive amounts of high-potassium vegetables, you are essentially asking those overworked nephrons to process a huge load of potassium. While potassium is generally heart protective, too much can be dangerous, leading to hyperkalemia, which can cause irregular heartbeats. By choosing vegetables with a lower potassium density, you reduce the excretory burden on your kidneys. You allow them to manage the electrolyte balance more easily, without being overwhelmed. This protects the kidneys from further strain and helps maintain a stable internal environment where your heart can beat safely. 6. Reduced bloating and abdominal pressure. This benefit connects the gut directly to the heart. When you eat vegetables that are high in certain types of fiber or complex sugars, like the raffinose in cabbage, broccoli, and cauliflower, they can ferment in the large intestine, producing gas. This gas causes distension or bloating. Now, here's the connection you might not know. When your abdomen is distended, it puts physical pressure upward on your diaphragm. This pressure restricts the space in your thoracic cavity, which can subtly compress the heart and the great vessels. The heart has to work a little harder to pump against this increased pressure. Furthermore, abdominal distension can activate the renin-angiotensin-aldosterone system, RAS, a hormone system that regulates blood pressure and fluid balance. The body, sensing pressure changes, can inadvertently signal the kidneys to hold on to more fluid and sodium, raising blood pressure. By choosing vegetables that are easier on the gut, well-cooked carrots, peeled cucumbers, or fermented vegetables that have already been broken down by bacteria, you minimize gas and bloating. You keep the abdominal cavity calm and spacious. You remove a physical and hormonal obstacle to healthy blood pressure. 5. Enhance parasympathetic tone. The parasympathetic nervous system is your body's brake pedal. It lowers heart rate, stimulates digestion, and promotes relaxation. The vagus nerve is the superhighway of this system. Certain sensory experiences can stimulate the vagus nerve, deep breathing, gentle movement, and interestingly, the taste of certain foods. Bitter compounds found in vegetables like dandelion greens, endive, and even coffee can stimulate the vagus nerve through taste receptors in the mouth. This is the cephalic phase response in action. However, if the bitterness is too intense, or if the vegetable comes with other compounds that irritate the gut, the signal can become muddled. By selecting vegetables that provide a gentle, not overwhelming sensory signal, you can intentionally stimulate the vagus nerve without triggering a stress response. This might mean choosing milder greens or lightly cooking them to reduce the intensity. The goal is to use food as a gentle signal to the nervous system that it is safe to rest, to digest, to slow down. Over time, this repeated signaling strengthens the parasympathetic tone, creating a default state of calm rather than a default state of vigilance. 4. Protection of the gut microbiome diversity. Your gut microbiome, the trillions of bacteria living in your colon, plays a surprising role in blood pressure regulation. These bacteria produce metabolites, particularly short-chain fatty acids, SCFAs, like butyrate from the fiber you eat. These SCFAs are absorbed into the bloodstream and have a direct, relaxing effect on blood vessels. They act as signaling molecules that tell the endothelium to chill out. However, if you are eating vegetables that your gut cannot properly handle due to their high fiber complexity or the presence of irritants, you might actually be feeding the wrong bacteria. You could be promoting the growth of bacteria that produce inflammatory byproducts rather than soothing SCFAs. By choosing vegetables that are well tolerated, perhaps lower in FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, for some individuals, you ensure that the fiber you eat is being fermented by the beneficial bacteria into SCFAs. You are cultivating a microbiome that supports vascular relaxation. You are not just eating fiber, you are curating an internal ecosystem that actively lowers your blood pressure from the inside out through chemical messengers produced by your own bacterial allies. 3. Regulation of the renin-angiotensin system, RAS. We touched on this earlier, but it deserves its own spot. The RAS is a hormone system that is fundamental to blood pressure control. When your kidneys sense low blood pressure or low sodium, they release renin, which starts a cascade that eventually produces angiotensin II. A powerful vasoconstrictor. It squeezes your blood vessels tight. It also triggers the release of aldosterone, which tells your kidneys to hold on to sodium and water. Certain compounds in food can inadvertently activate this system. For instance, a high intake of certain minerals or plant compounds can be interpreted by the kidneys as a fluctuation that needs correction. If your kidneys are already sensitive, eating a large volume of a potent vegetable can send a signal that says, we need to hold on to more fluid to balance this, which is the opposite of what you want. By choosing vegetables that are neutral in their effect on renal signaling, you allow the RAS to remain quiet. You are not provoking the system into action. You are giving your kidneys the message that everything is stable, that there is no need to constrict vessels or retain fluid. This is about avoiding the accidental triggering of your body's own blood pressure-raising machinery. 2. Prevention of oxalate overload. Oxalates are naturally occurring compounds found in many plants, especially spinach, beets, Swiss chard, and rhubarb. They are part of the plant's defense system. In the human body, oxalates can bind to calcium and form crystals. For most people, these crystals are harmlessly excreted. But for others, particularly those with compromised kidney function or a history of kidney stones, oxalates can be problematic. The issue goes beyond kidney stones. Oxalate crystals can deposit in tissues throughout the body, including the blood vessels and joints. This deposition can cause micro-injury and inflammation. When these crystals lodge in the endothelial lining, they create rough spots that the immune system reacts to. This chronic low-grade inflammation contributes to arterial stiffness. By minimizing high oxalate vegetables, you reduce the load of these crystal-forming compounds. You protect the delicate endothelial lining from physical microabrasions. You allow the blood vessels to remain smooth and flexible. This is not just about avoiding kidney pain. It is about preserving the structural integrity of your vascular system at a microscopic level. 1. The master regulator, reclaiming dietary autonomy and nervous system safety. This is the climactic benefit, the one that ties everything together. We have talked about potassium, vitamin K, oxalates, inflammation, and gut bacteria. But the number one benefit of being discerning about your vegetable intake after 60 is the restoration of a sense of safety in your own body. For years, you may have been eating foods that you were told were healthy, all while your body was sending you distress signals. Perhaps it was bloating, a slight uptick in blood pressure after dinner, a feeling of being wired rather than relaxed after a meal. You may have ignored these signals, overriding them with the belief that the food was good, and therefore the reaction must be in your head. When you learn to listen to the specific physiological responses of your own aging body, and when you have the scientific framework to understand why those responses are happening, you reclaim your autonomy. You stop eating by dogma and start eating by data, the data of your own experience. This is the master regulatory benefit. It is the understanding that the method of choosing food based on your unique biochemistry matters more than any universal dietary rule. It is the profound peace that comes from knowing you are not fighting your body, but collaborating with it. You are no longer a passive recipient of health advice. You are an active, informed participant in your own physiology. When you remove the vegetables that were sending stress signals, whether through nerve irritation, kidney strain, or vascular inflammation, you create a profound internal quiet. The body no longer has to constantly correct and compensate. The heart can beat in a relaxed rhythm. The blood vessels can remain dilated. The kidneys can filter without urgency. This is not about a miracle food. It is about the removal of chronic interference. It is about giving your body the silence it needs to perform its ancient, intelligent functions of healing and regulation. You are not just managing blood pressure, you are creating an internal environment where healthy blood pressure is the default state. Practical application: how to approach this safely. This is not about fear. It is about curiosity and precision. If you are over 60 and managing high blood pressure, here is how you can apply this information without swinging into restriction or anxiety. First, keep a simple journal. For 1 week, eat as you normally do, but write down what you eat and take your blood pressure 2 hours after each meal. Don't change anything yet. Just observe. Look for patterns. Do you notice a consistent spike after meals containing spinach, kale, or a large tomato salad? Second, consider the preparation. Cooking vegetables changes their chemical structure. It breaks down oxalates, reduces the potency of some alkaloids, and makes fiber more digestible. If you love broccoli, try steaming it thoroughly rather than eating it raw. If you enjoy greens, sauté them rather than blending them into a smoothie. Heat can be a powerful tool for reducing the biological intensity of a food. Third, rotate your vegetables. Don't eat the same thing every day. Diversity is protective. If you eat a high-potassium vegetable one day, follow it with lower potassium options for the next 2 days. This gives your kidneys time to process the load without being overwhelmed. Fourth, work with your doctor. If you are on blood thinners, do not make drastic changes to your diet without consulting your physician and possibly getting your INR, International Normalized Ratio, a measure of blood clotting time, checked more frequently. The goal is stability, not volatility. A sample approach might look like this. Breakfast: a vegetable omelet with well-cooked zucchini and bell peppers, lower in oxalates and potassium compared to spinach. Lunch: a salad with arugula, a peppery green that is lower in vitamin K than kale, cucumber, and a simple vinaigrette. Dinner: roasted carrots and parsnips with a piece of wild salmon. These root vegetables are grounding and generally well tolerated. Snack: fermented vegetables like sauerkraut or kimchi, which provide probiotics and have already been partially broken down by bacteria. The key is gentle experimentation. Try removing one high-potassium or high-oxalate vegetable for 2 weeks and see how you feel. Do your afternoon readings become more stable? Does the bloating after dinner subside? Let your body be the guide. Critical safety warnings. This information is for educational purposes and is not a substitute for professional medical advice. It is a framework for understanding, not a prescription. If you are taking any of the following medications, you must exercise extreme caution and consult your healthcare provider before making significant dietary changes. Blood thinners, anticoagulants, like warfarin, coumadin. Changes in vitamin K intake can have serious consequences. Blood pressure medications, particularly potassium-sparing diuretics. These medications already increase potassium levels in the blood. Adding high-potassium vegetables can push you into dangerous hyperkalemia. ACE inhibitors or ARBs, common blood pressure meds. These can also affect potassium regulation. Lithium, used for bipolar disorder. Changes in sodium and fluid balance can affect lithium levels. You should stop any dietary experiment immediately and seek medical attention if you experience irregular heartbeats or palpitations, shortness of breath, severe dizziness or fainting, muscle weakness or confusion, signs of electrolyte imbalance. Do not assume that because something is natural, it is safe for your specific condition. The dose, the context, and the individual always matter. Engagement closing. Here is my question for you, and I would love to read your thoughts in the comments. Have you ever noticed a specific food, even a healthy one, that seemed to consistently raise your blood pressure or make you feel off? What was it and how did you figure it out? If you found this perspective valuable, please consider subscribing. We explore the nuanced science of healthy aging here, not to give you more rules, but to give you more understanding. Because the more you understand the beautiful, complex machinery of your own body, the more you can live in harmony with it, rather than in conflict with it. There is a deep wisdom in learning to listen to the body you have today, not the body you had at 30. The vessel changes, the signals shift, but the capacity for vitality remains. It simply asks that we pay attention with a little more precision, a little more humility, and a lot more respect for the incredible conversation happening beneath the surface of our skin. Thank you for listening.